Okay, I think quite a few of you are in now, so I'm going to get started because we have quite a bit of content to get through. Good morning, or afternoon now, actually. Good afternoon. My name is Stacey DeCalma and I work in the sector capacity team at QCOS. I'd like to welcome you to this COVID Learning Exchange. This webinar today is part of a bi-monthly series that QCOS has been hosting around all of the different learnings we have gleaned from the COVID-19 pandemic. And the purpose really is for us to consider how we can apply these learnings into our work into the future. So this month's webinar is focusing on the use of technology, particularly in human-centred service delivery. So what kinds of things do we need to consider? And what will we take with us into the future? Now, before we get into the content of the workshop, I would like to acknowledge the traditional custodians of the land on which I am on today. And for me, where I am is the Yugambeh people. I live on their land and raise my family here, but I would also like to acknowledge the Darumbal people in central Queensland, on whose land I was born and raised, and the Yagara and Turrbal people of Brisbane, on whose land I'm usually on in West End. We're doing some work from lots of different home offices around Brisbane today. Our lockdown has ended. And I know that some of you on the line are continuing with your lockdowns, and I'm really thinking of you. So without any further discussion from me, I would like to introduce our first speaker, Jess. We have three really exciting speakers on the line today. We have Jess, Jennifer and Anne, who all bring quite a different perspective with them. All right, now Jess has quite a list of different achievements and wonderful things that she's done. She's currently working at the Good Thing Foundation, which is, they do some really exciting work, and we will be sharing some of their work and report in our post-event email, so keep an eye out for that. But having worked across the not-for-profit and social purpose and government sectors for over 20 years, Jess is passionate about social impact work that improves lives and creates a more connected community. With quite a few different qualifications, Bachelor of Arts, Bachelor of Social Work with honours, graduate diploma in primary education, her roles have spanned the focus areas of disability, family support, child protection, education and digital inclusion. Having built her understanding of grassroots delivery as well as government policy development, Jess has cemented her career in leading growth and innovation in the not-for-profit sector. Her focus is strategy and business development that ensures social purpose organisations have sound commercial business model that can deliver long-term sustainability and impact. As the National Director and now CEO for Good Things Foundation Australia since October 2017, Jess has led the establishment of an innovative Australian social change organisation, founded a thriving national digital inclusion network that has over 3,500 community partners, and is recognised as a leader in digital inclusion in this country. Thanks so much for joining us, Jess. I'll hand over to you.
Thanks so much, Stacey. It's brilliant to be with you, joining you in Queensland today. I'm actually now living and working in Sydney, but today I'm coming to you from the Darug and Gundungurra people's land on which I am staying and living at the moment while in lockdown here in Sydney. So I'd like to pay my respects to their elders, past, present and emerging. I'm just going to share my screen with you so you can see. I'm hoping that it's all going to work fine and you can see that okay now. I'll just have a thumbs up, make sure that everybody can see.
That's great. We can see that. Thanks, Jess.
Fabulous. That's really good. Thanks, everyone. So look, as Stacey said, I've worked quite a lot in Queensland over my career in different spaces, but now I'm focused on digital inclusion as one of the key areas of work that I think is so essential for all of us to be focused on, and that certainly has become a focus over the last 12 to 18 months in the sector. Because we know that a lot of the people that you support every day and the organisations that you work for support are more likely to be digitally excluded. So what I'm going to share with you today, rather than talking a bit more about Good Things Foundation, what we do is really about a report that we released just last week. But just so that you know, hang on a minute, make sure that I'm on the right screen so you can see my next slide. So Good Things Foundation, for those of you who don't know, we've only been in Australia for 4 years now. It was our birthday last week, so we had a bit of a celebration remotely. But we have been working in the UK for about 10 years as well. So our vision is a world where everyone benefits from digital. And we're in particular focused on supporting people to have the skills and confidence that they need to be able to engage in the technological world these days, which we all need to do. And the way we do that is by working in partnership with and building capacity in community organisations. And as Stacey said, we have in the last 4 years built a network of 3,500 community partners all over the country who are delivering programs, digital literacy programs like Be Connected. Some of you might have heard of that, which is supporting older Australians to get online. Some like Health My Way, which is a digital health literacy program. But we do that by co-designing resources with people that actually need support to improve their digital inclusion. And we do that also by advocating for change, by raising awareness of the issue of digital inclusion and the digital divide, and talking about some of the solutions that could fix it. And so today's really what I'm going to talk to you about is some of that piece around raising awareness, so that we've got the kind of the Australian picture of what's happening in digital usage over the country, particularly in the last 12 months. So this is our digital nation landscape image infographic. We've done a couple of these now. This is our third one. But I suppose this has been a particular year where we have actually seen such a huge interest in digital use because of COVID and the fact that we've all needed to be able to engage online for all sorts of reasons. Sitting here in lockdown now, all of us have to make sure that we're able to use digital technology, even just to buy food, to be able to engage and to make sure that we're getting the right health information. Everything is going online. So if people are missing out, then certainly they're missing out on participating fully in our society. So this image really highlights some of the groups of people that are more likely to be missing out. Now, at the top, you'll see that actually there's been about 70 reports. This report is actually a full report this year. We've got a page report, and I'll show you where you can get access to that. But there's been 70 different reports that's gone into this report because so many people have been interested in what's going on in the digital world in the last 12 months. And one of the things suggests that actually digital inclusion is getting better. So one of the reports from the Australian Consumer Media Association suggests that 10%, it used to be 10% of people in Australia that were completely offline. And since COVID, that's gone down to 1%. Now that kind of hides really the impact of what's truly happening, because about 40%, less than 40% of Australians are saying that they feel confident in being able to stay in touch with technology. So even if people might have been online once in the last 3 months, does not mean that they're digitally included. And actually there's a significant group of people that you can see are more likely to be missing out. So we know that people with disabilities, over on the left-hand side, we've got people with disabilities, our lower users of digital and social media, much more likely to be digitally excluded. We know that people who are on low income are also more likely to be digitally excluded, and they have trouble paying their home internet bills. They're more likely to be on mobile only, which means that you're not necessarily able to do all of the things that we need to do today to be online and to be applying for a job, for example. It's really hard to do if you've just got a mobile phone. We know new migrants and refugees have low skills and low access to digital technology as well. And people living in remote areas, only 1/3 of our Australia is covered by mobile connectivity. So there's a significant difference there. And our First Nations communities, 30% of First Nations households in remote communities do not have access to a household phone or internet. So again, there's a significant group of people that are missing out. And what we know to combine people to be digitally included, there are 3 key things that we talk about, and that's part of the Australian Digital Inclusion Index, and they are affordability, ability, so skills and confidence, and access. And so that's access to technology, the right technology and data, but it's also about accessibility and making sure that the technology that you have is right for you. So I suppose the impact of the pandemic has shown that we have used digital technology more than we would have before, like 10 years of growth in data consumptions brought forward by COVID. But again, what that means is that the people that are using it, the people that are missing out, are more likely to be left behind. I've already talked a bit about the low income users, but mobile only users score 19.3 points below the national average of digital inclusion. And that's because, again, you're not really able to do the same activities as you may be able to do if you're using a laptop or a desktop computer. You can see just down there, if you're wanting to have a look at the report, that's the link to it there. I'd highly recommend you have a look at it. It's about 35 pages long, and there's a lot of different reports that have been made. So I recommend you have a look at that.
And Jess, to interrupt you, sorry, just about that report, just to let people know, I've put the link for that in the post-event email. So when you receive that, you'll get a link to that report.
Fantastic. That's great. So I think one of the other key things that's really important about this slide, and one of the key pieces of information, we know that more people have been online, but 1 in 2 are very concerned about their online safety. So that support around how to be safe online, what you need to do to protect yourself, is a really big concern for most of Australia, let alone people who are coming online for the first time. So this is a significant area of work that we're focused on, working alongside the eSafety Commissioner. But I think it's really important that when we're talking about people going online for the first time, that this is something that needs to be involved as well. And the 61% lack confidence in identifying misinformation online. If you're thinking about the information that's going out today around health and vaccines and all of the things to do with COVID, if 61% of people don't feel confident that they can identify misinformation online, that's a significant issue for our community, because they're not able to see when the information is right or when the information is the information they should be taking on. And I suppose just on the right-hand side of this slide, we're talking more about the impacts of digital exclusion. So this is, if we've got 21% of First Nations school children without internet access at home, then that's 21% of children who are missing out on the opportunity to continue learning if they're having to learn remotely. But even beyond having to do remote home learning, actually, internet is essential to the use of to our education today. Being able to research things, being able to look things up, being able to type an email or an assignment. All of our work today, we know that 87% of the skills, 87% of jobs today need digital skills, and that's only going to increase. And so if we've got 21% not having the ability to try that and use that at home, then they're going to be left behind later on. And I suppose in terms of people with disabilities as well, we know they're more likely to be digitally excluded. But for those people who are online, they certainly have a higher likelihood of experiencing cyber abuse and bullying online as well. So that's, again, a significant area of work for us to be doing to make sure that people with disabilities, as they do go online, know how to manage and are supported to deal with that kind of thing, but also that we've got the regulations available for people to be able to report that and get the support they need if that's caring for them. So look, I mean, that's kind of my 10 minutes really. And I just wanted to kind of give you the overall view of some of the research that's going on in the world at the moment, and in particular in our country, looking at the issue of digital inclusion, because really for the people that you're supporting today, whether it's you're doing that online or not, this is an essential skill for them to have. It is essential for people to have the access to an affordable device and the ability and skills to be able to use it so that they can fully participate in our communities. And I'll leave it there.
Thank you so much, Jess. Really interesting stuff, and such an important consideration for all of us to have, not just what and how we might be delivering services, but who can actually access those services. And look, we've had a lockdown in the southeast part of Queensland last week, which again, a lot of us have had some preparation for that, in that we've dealt with lockdowns previously. But this week we have seen smaller communities such as Yarrabah and Cairns actually now having a lockdown to address some of the community spread of COVID up there. And speaking to some of those services last week, there is real concern for them in how they will actually be able to deliver services online when their internet just really isn't up to scratch, or service users might not actually have access to the resources they require to actually engage with technology. So really important considerations for us to make when we're considering how we might deliver these services. Thanks so much, Jess. I'm sure everyone's very excited to be reading that report. And as I said, we'll get that to you in the post-event email. Now, I would like to introduce Anne Livingston next. Again, we're really lucky to hear from Anne. Hi, Anne. She's got a great career behind her so far, and I'm sure lots more to offer. Anne Livingston has over 35 years experience in primary healthcare and community services sector, with a particular focus on community-based care. Anne worked early in her career directly in areas of service management, service development, policy reform, and research, specifically in community care. For over 10 years, she was the State Community Care Manager for a national peak organisation, also having national responsibilities across a range of interest areas, including technology, quality, workforce, and service model reform. Anne is currently involved in several national and international activities specifically focused on the promotion of quality innovation, new service models, special needs groups, workforce redesign and development, consumer engagement, new economic development opportunities, and the incorporation of new emerging technologies in community care. Internationally, Anne has been involved in several projects, including in the areas of quality, standardisation, special needs groups, innovation, social service redesign, deployment of living labs, and enabling technology. She's currently the Australian representative on a number of international standards organisation work areas, which are highlighting the role of that innovation will play in better supporting individuals. This work includes being the international convener of ISO Technical Committee 314 Ageing Societies Communications Group. Currently, Anne divides her week into two roles as a Projects and Development Director for Global Community Resourcing, where she is leading a range of projects and research nationally and internationally, and as the Executive Lead of the Aged Care Industry Information Technology Council. Anne has been the chair of the Queensland Government-supported Community Care Smart Assistive Technology Collaborative since its inception in 2015. She also has appointments from the Minister for Innovation, Science and Digital Economy as the Queensland Digital Champion, where since 2017, she has had the opportunity to promote digital uptake and literacy across the health and community sector. By the Premier of Queensland to the Ford Foundation, where she's passionate about how more innovative approaches can be applied to better support individuals who are in Queensland institutions as children, and was a partner in Advance Queensland Regional Innovation Program. Anne was induced into the National Innovation and Technology Across Care Hall of Fame in 2018 for her outstanding contribution to the national agenda promoting innovation in community-based care. I don't know how you're going to fit all of your learning you've had, Anne, into 10 minutes, but I'm sure you'll give it a good go. Thank you very much. Over to you, Anne.
Thanks, Stacey, and I'll make sure Georgie cuts that profile a little bit more next time. Thank you for that warm welcome, and in my remaining minutes, I think I better get going, and I'll just make sure that slide deck's working. So I'd just like to pay my respects also. I'm presenting from the beautiful Kondamuka land today, but our office is in the lands of the Jagera people, and I pay my respects to elders, both past, present and emerging. Yeah, I am going to juggle those three hats. and just sort of talk from a service perspective, social service across the spectrum of the sorts of community care services that are delivered, and just give an insight into some of the work that we've been doing, particularly what our research is telling us, where perhaps future investment could be made most wisely. But I guess, like Jess indicated, we need to do things better, and doing work better also it includes narrowing the digital divide. And so I'd like to champion that cause to, I guess, employers and boards where their expectation is perhaps, for example, the lowest paid workers bringing their own devices and doing their own training. And picking up also on Jess's point, and we didn't confer on this, Jess, but marginalised groups, there's great opportunities that the role that innovation and technology can play, but we know that there's great levels of disadvantage. And I'll just touch with, I guess, my two passion points around really quality and standardised approaches. But I'm not a technologist, and it's not about technology. It's actually about us doing work more appropriately and getting the service model right, supporting workers to digitalise their work, but also not doing anything without a really impact on quality. If it doesn't make someone's life better, why are we doing it? And if it's not co-designed with the very end users, we should be thinking twice about venturing there. Through my role, I see plenty of work where great investments made in technology, and at the front door you can trip over that investment. It's not utilised, and it's not appropriate or targeted for the sort of work. So the work I do is around working with predominantly providers, but also with groups and individuals around co-designing new futures around innovation and technology in community care. Stacey mentioned the collaborative, the Community Care Smart Assisted Technology Collaborative. We were established with a seed grant after we did a range of research for 7 years through Queensland, looking at how service providers were positioned for a future where innovation and the greater uptake of technology might place them. We're really proud to today have over 2,000 individuals, whether they be service providers, researchers, technology developers, startups, and individuals who just want to create better futures for themselves via their community service delivery and support. We're also really pleased that we've got a number of projects. We can quantify them in over $20 million worth of projects revolving and being put in place because of collaborations out of that. So I'll talk to you later about where to join the collaborative. But I also wanted to concentrate on the work of the Aged Care Industry Information Technology Council. This was an initiative started in the early 2000s, and this is nearly in its 20th year. It was set up by the then two peaks, Aged and Community Services Australia and ACCA, the Aged Care Association of Australia. What we've concentrated on the last 5 years is building the evidence around what's required in the sector. We did a landmark study commissioned and privately funded by the council with Flinders University, developing a technology roadmap for the sector. That roadmap is as apparent and meaningful today, and we're still working with governments to hopefully increase the uptake of the recommendations we made there. But more recently, we did a piece of work, and I think it's a really valuable piece of work around what is needed in the sector and what is actually evidence to work. And this piece of work, we've been tracking who and where it's being used, and we know a lot of community care providers are using it to build their strategy around investment and to really significantly target what they're doing in the sector. We recently finished a piece of work that was commissioned minutes before COVID, commissioned in early March, but played out through the COVID period. We know this work as the Care IT report, but it really looked at the capabilities within the sector and the digital readiness to uptake innovation and technology. We looked at 5 key areas: business to government, smart home technology, telehealth, surveillance and monitoring, and a broad range of issues reporting to government portals. I'll touch on the results of that later. And we've just finished a large piece of work with the Digital Health CRC, AXA, the then Aged Care Guild and Swinburne University, developing up a framework which we can apply to co-design activities. And I guess we're hoping that they will be applied to many projects in post Royal Commission times. And we've just, haven't published yet, but just completed, hot off the press, a study into the use of clinical software, this time only in residential care, but we are also looking at venturing that out specifically to community care. But a couple of key messages from our work is that there's great opportunity for impactful data. Some of the areas, and this is not conclusive, but just in the 10 minutes I've got to touch on it. Falls technology, we're really at the stage now, the maturity of the technology is not just about detecting falls, but moving to prediction of falls and therefore prevention. Great opportunities for people to lead more independent lives when we can use technology to do that. There's a range of AI issues that we're looking really focused on in terms of improving care providers' performance, but also producing better quality outcomes. And when you combine AI with things like blockchain, it's really the opportunity to transform the sector. We also are very heavily involved in the Internet of Things and the integration of smart home devices into everyday living. I'm really pleased on Contammuta Land and the islands we're deploying smart home technologies to a number of groups with great success. What we did find in our Care IT report is nothing new on the screen there. We found massive increases in the sector's use of particular digital platforms. But we also found some really magnificent innovation in the supply chain and the manufacturing that revolves around the items and the products at social care delivery. And we did find that telehealth and telecare accelerated, as Minister Hunt said at the time, 10 years in one day, when we had a universal announcement of telehealth. But we know that people are using that in limited supply and in limited settings. We also did find, and I haven't got use of really creative use of other devices, like things just as simple as electronic access through door locks and using screening stations that were digitalised. But some of the things we found that are concerning is that we found that 40% of the sector surveyed is still manually uploading data to portals. Now, this also relates to quality data, and we know that it's not only being manually uploaded, but it's being uploaded in some cases 3 months after the event. We can't talk about quality without getting closer to the point of service delivery and collecting that data and reporting that data. And we plan to do a whole lot more work around that. We know that there's really great advances that we can make if we had common records, but we actually found that 73% of the service providers we surveyed really didn't even know if things like My Health Record were in place. We also found extreme issues around government to business, to social care systems, reporting requirements. And I don't think that's any news to anyone probably on this link, but I guess we found inroads to maybe make improvements in that. And I guess that through all this, the work around has shown us that no longer providers are really willing to uptake bits and pieces, ad hoc technology that just interfaces with each other, but really a call for full integration of that technology. We also know that there's real great opportunities doing work better and really focusing on the 4 Ds, as we call them, the dangerous, dirty, dull and dear work that we've got. And perhaps we can deploy with our current workforce shortages and the projected future workforce shortages to see the role that technology and innovation can play. But really, there's a lot of key considerations to get there. Least of all, and top of the list, is digital inclusion. I often reflect on the first week of the Royal Commission into aged care, when 3 direct care workers spoke at the Commission about the sorts of technology that they were provided. But they also talked about the fact that they didn't use it to its capacity or at all, because they hadn't been appropriately trained, appropriately funded, or actually given some buddying to actually help them use that. And you suspect that some of them might have gone home and got their kids to help them if they were fortunate enough at the end of the shift. We also know that if we won't get anywhere if we don't reform the sorts of funding and service models we have. And in that, that's really about building workforce capacity. But also, I guess there's some whole issues around co-design that are lacking in the system. And from a board's point of view of community service delivery, there is a lot more reflection that has to go in respect to governance, quality governance and risk. It would be remiss of me if I didn't talk about some of the work we're doing with more marginalised groups. These are real opportunities if you're marginalised in your community and you haven't got a community of interest or of like people around you. Technology can play a role there, but there are many hurdles to that. Least of all, the connectivity, the cost, as Jess was indicating. But we've really got to all work together about building a better bridge across that divide and making it work for more for everyone, but also really focus on marginalised groups. We know that there needs to be a lot more quality focus. We're calling through the council on a requirement for providers to have minimum standards around the types of technology they're uptaking. This can only be done in a consolidated industry approach. And I guess importantly, we've got vendor engagement in that quest. There's also a lot of work being done globally, and some social care providers may not know that, but there's a series of standards now about to emerge in the marketplace that talk to standardisation in a number of groups, from supporting carers to assisting people with dementia, to ensuring that we can play out the role that technology and innovation will play in multi-generational communities. So how do you get involved? There's the list of key sites for you. Just wanted to plug a couple of things that we've got coming up. On our Community Care Smart Assisted Technology Collaborative, our next webinar is looking at evaluating mental health apps. And the Aged Care Industry Council has a workshop with a couple of key experts talking about the requirements of digitally unaged workforces of the future. Stacey, I haven't been keeping tab of time, but hopefully I haven't run too far over my 10 minutes. Thank you.
That's all good. Thank you, Anne. Thanks very much. And we've been able to hear now around digital inclusion and what we need to really be keeping on top of regarding inclusion. And Anne's painted a really good picture around innovative technology and what that landscape currently looks like. Our next speaker is going to be able to speak about the evaluation of turning to technology for service provision. And Jennifer Black has worked with quite a few different partners. I know she's going to speak a little bit more about the partnership and what that actually looked like in their research of turning to technology in service delivery. So I'm very excited to hand over to Jennifer. Jennifer is the CEO of the Queensland Alliance for Mental Health, which is the peak body for community mental health sector. She is relatively new to Queensland and has previously held some roles in Victoria, including Deputy Mental Health Complaints Commissioner and the Executive Director of Mental Health and Drugs and Alcohol Service for Barwon Health. Initially trained as an occupational therapist, she has over 30 years experience in government, public, private and not-for-profit mental health sectors. Really excited to hear what you've got to say, Jennifer. Over to you.
Thank you, Stacey, and thank you for inviting me to come and speak. I'd like to echo everyone's acknowledgements of the traditional owners of the land on which we meet and pay my respects to elders past, present and emerging. So the Queensland Alliance for Mental Health is the peak body for the community mental health sector. So they're non-government, not-for-profit organisations that deliver grassroots services to people in their communities. And look, who would have thought even 6 months ago we'd be still in the position that we're in? But when I came to Queensland just before COVID hit, when I still thought I'd be able to visit my children in Victoria, we went to work pretty quickly to try and support the organisations that were struggling with the new information and the new way of working. But actually what we saw was a really resilient sector who was able to really pick up and turn things around pretty quickly, with the end point in mind of really supporting the people that most needed it in those times. So what did we do? We formed a partnership with Brisbane South PHN, Metro South Hospital and Health Services, the mental health components, and Health Consumers Queensland. And I guess we were interested in trying to map out the changes, the service system changes that had occurred, particularly in those early days of COVID-19, when we were really concerned our hospitals might become completely overrun as COVID clinics, and how we might transform our services. Luckily, at that point, we didn't get to that. So we're interested in trying to map out those changes and understand how that impacted on services, but actually more importantly, how was this experienced by people who were trying to access services and the people that support them? So we did a number of things. Like I've said, we mapped out the service system changes that had occurred. We did it through interviews, focus groups, that sort of thing. We sought to understand people's experience of the changes. We looked at the literature from across the world about what other people were saying about this, and we've produced a report with our findings, which Stacey will send you a link to after today. So I guess the most common change was replacing face-to-face with telehealth. And really our services used whatever platforms that they could, whatever people had was what we used. You know, lots of advice about, you know, don't use this, don't use that. Well, you know, let's get real. People had to just use what they could or what was accessible to the people that they were trying to support. We know that some services just continued with face-to-face even throughout the whole process. We know some did a hybrid, and we also know some that went totally online. So what worked? Well, it gave people a choice, which they hadn't really had before. And for some, it actually improved their access because they didn't have things like travel and travel costs, and the time that it took to do that. Some people felt much more comfortable and relaxed at home, particularly when you're talking about your mental health concerns, to be doing that in a private place at home, relaxed in their own environment. And actually for a lot of the services, they added a social component to what was happening. So that social connection during the lockdowns was really important to some people. And strangely, some of the same things didn't work for people. So not everyone experienced those things as positive. the virtual environment wasn't great for everyone, and for some types of therapy that wasn't the best way to do that. You know, for people who were having to homeschool and look after relatives, that sort of thing, that was actually quite hard for them. Certainly in the mental health space, there seems to be a personal preference, either for digital or doing it face-to-face, whether you could deliver it digitally or not. For some people, there were real privacy concerns. If they wanted to talk about issues they were having, you know, there might be safety and confidentiality issues. We know of, particularly in situations where there might be family violence, that was problematic for some people. And people reported that building trust and rapport was really difficult online, and particularly if you were engaging a service for the first time, that really wasn't necessarily the way to do that. So we identified some enablers and barriers to this working. And people reported that where the service actually helped them with the technology gap, you know, in terms of skill, that was really important to enable that to work properly, and clear communication about, you know, what's changed in the service delivery was really important. You know, flexibility of funding models by the government funders was really important, to be able to change your the service that you offer quickly. And staff in services reported, you know, how the organisation supported them to make that change was really important too. In terms of barriers, well, not everyone had a device. They lack skill. You've heard a lot of those barriers already this morning. You know, that was very clear, and we know of some of our service providers who actually just bought some technology for people so they could stay connected. Some people who were accessing services said they closed down, and that was actually really quite problematic during the isolate, you know, the fairly strict lockdowns at the beginning, that they found that quite difficult. And it was difficult to get face-to-face help at that time. And the other barrier was that people felt that there was just a lot of confusion in the very beginning about what the advice was. Was it this? Was it that? Did it change on a daily basis? And that kind of added to the confusion of the whole thing. So in terms of next steps, you know, we concluded that on balance, the move to digital was great. But in a mental health setting, it has to be just one of many options, because people need choice, and if it adds choice, then that's fantastic. We felt there really needed to be some best practice standards, which we've just heard Anne talking about, so I'll be Googling those myself after this, and really supporting organisations to actually to be able to do that. I think the issue of access to technology is a big one, and probably a big one for the cohort of people that we deal with. And I'm not sure what the answer is to that. If people don't have internet, they don't have phones, you know, that's a big problem and a big barrier for people. And again, we also concluded that you really need to co-design these things with the people who are accessing them to actually make them as relevant as possible, and then evaluate their effectiveness, and are they equally as effective as face-to-face treatments. That's about it from me, but just acknowledging Queensland Health for funding the project, and our partners, Health Consumers Queensland, Metro South Mental Health Services, and Brisbane South Primary Health Network, and for all of the people, the individuals that shared their experiences and stories. That was really valuable as part of that process. Thank you.
Really interesting. Thanks very much, Jennifer. It's great to hear a local evaluation of how online service provision has really turned out, and so important for us to evaluate these things before we go barreling ahead with our idea of what good online service provision might be. So thank you for that perspective. I actually think that the question submitted in the Q&A, we're going to ride on your energy, because I think that one is for you. Eleanor has asked, she says she works in the family violence sector, and they've done some good work around online men's behaviour change programs and the challenges and opportunities that they present. She'd be interested in hearing some more about how you mitigated the challenges for people experiencing family violence in telehealth mental health sessions.
Yeah, I mean, I guess we didn't do that specifically. That was our service providers.
Yep.
You know, a lot of the services we support aren't specifically family violence services, but like in all community services, that's something to be aware of. I think for our services, they were trying to be pretty in tune with what people needed, and some services were very acutely aware where they needed to perhaps continue in a face-to-face way, or think about the security of that, you know, whether that can be done, you know, at a community place that people could go to actually do that online therapy. I don't know if I have all the answers to that, but I think that, you know, that's the important consideration, isn't it? To think about where someone's going to be safe to be able to say what they need to say and get the support that they need to get.
Yes, absolutely. And this has been a discussion that we've had in quite a few different spaces over the last over 6 months now, really, around the access and comfort in your own home versus another mechanism through which control can be used against someone. And unfortunately, sometimes technology is that mechanism. So something we need to continue to be mindful of and continue to evaluate what we understand about its use.
I would say, just add that I know that for some of our services, they set up a connection in a room in the offices, so people could actually go there. They're not seeing other people, but they could go to a place to do that work.
Yeah, great. We've only got a few minutes left. I'm just going to encourage anyone who has a question to please submit it in the chat or the Q&A box. We might have a time to have a couple more while we're waiting and while people's cogs are turning. And what do you think, where is the best place for services in the sector to currently be investing their resources and time as far as investigating what technology might be assisting them into the future?
That's a really difficult question, but a question I get asked every day. Stacey, I guess, how long's a piece of string? I think no investment should be made without really a strategic intent to it. And what I was trying to influence is that, you know, if a technology can be proven to give the end user a better quality outcome, that's what you should be investing in. So that would mean many different things for many organisations, from whether it be like an individually tailored technology assisting a person to live their lives more independently, to something that your organisation implements to run their data collection better. So, you know, it is horses for courses. It's about what your strategic end goal is. But I guess there's not a lot of work for providers around what gives you a return on investment and how to measure that quality impact. And they're the areas that I'm very interested in, the need to encourage more research and exploration of those, and to really develop, I guess, some guides for service providers and boards to to follow. But least of all, I guess one of the critical issues is to really invest in the safety and security of the technology and the data that you provide. We've had significant breaches of cyber safety and security in the sector. Some of them are known, many of them aren't known if they don't have to report to their shareholders. For example, the council ourselves, we get calls on a daily basis for help around that issue. We've got very vulnerable populations, we've got vulnerable workforces. We know in some cases that 15% of service providers' data around their workforce and their clients are on the dark web for purchase. We want to minimise that impact and improve the safety and security for the sector.
Thanks very much, Anne. Sorry to pose a tricky one for you to answer. And really, actually, your answer is a good segue into the comment in the chat from Wendy around elder abuse. Wendy works in elder abuse, and she's just commenting on the prevalence of a financial abuse, particularly with seniors, and that this is often done digitally. Jess, do you have any stats around the prevalence of that?
I don't have any stats off the top of my head, but I certainly know that the people who are most affected by scams online are older Australians, so they're more likely to be affected. And so I would suggest that, the key thing for this is around making sure that people have the skills and confidence that they need to get online and to know how to do that safely. Now, that doesn't, if you've got somebody in your family that is trying to take your money, then that's a different situation than if you've got, a romance scammer that's trying to get you to send them money. So that's a different situation. But I would suggest, I think that the key challenge for us in all of the sectors is to ensure, as Anne was talking about, that our workers that are supporting people in the community have enough of the digital literacy skills themselves, so have that kind of capability to be able to see what they can do to be able to support somebody to get online or to know how to be safe online in particular. So we've got people with disabilities, or we have people going into people's homes to support them for a whole range of reasons, then really they're going to be the people that they're turning to ask for help with what's going on here on this computer thing that I don't know how to use. And so, unless we're making sure that the digital capability of the workforce is skilled and that people see this as a core part of their practice to make sure that they know how to do this, then we've got a real problem. I would also just say that last week, in terms of the question before, last week there was a release of the Digital Transformation Hub that Info Exchange has developed with a whole range of different partners. And I think that's a really good place to have a look at and start in terms of people's digital transformation journey. It's got a whole lot of tips and tricks on and suggestions, particularly around cyber safety. Agree with you there, and absolutely that's a key challenge for us. But I would suggest that people have a look at it specifically for the not-for-profit sector. And it's a really good place to start for boards and for people if they haven't started that journey already, which I'm sure most of us have on this call because you're all here. But I think, it's definitely a step forward for the sector in terms of thinking strategically about what the things are that they need to be getting involved in terms of both, systems, but also practice.
Thanks very much, Jess. That workforce capability, really important for sector employers to keep in mind too, as we're considering what things we're offering.
Absolutely.
We're just about to close off. I do have one more question in the chat though that I want to go to, and this is open to any of you to give a very quick answer to if you have one. What could be an alternative to Zoom or webinars to reach out to certain groups that might be reluctant to go online to avoid unwanted disclosures by solely being associated or attending? Do you have any other platforms or user-friendly suggestions at all?
I think as Jennifer said, it's what works for the people that you're connecting with. We know that our community partners who were trying to teach people how to use technology, using technology during lockdowns, which is pretty tricky, you had to use what they were already using. So one group was using Facebook Messenger because they already knew how to use that. So sure. I think always about what is the technology that people already know how to use, so that they can make that connection, and then you can progress to other different types of platforms if people feel more comfortable.
Going back to that principle of co-design.
Yep.
Yeah, sure. Well, we've met time now. I want to say thank you so much to Jess, Jennifer and Anne for your time and generously sharing your learnings with us today. There's so much here for us to consider. As I've mentioned, we will be sending out some links and things. Maria is going to put up a poll now to just see how you found this presentation. As I've mentioned, this is just one of a series of COVID learning exchanges that QCOS hosts. So we'd love to see you at the next one, which will be in October. And at that learning exchange, we're going to be focusing on the learnings that we can glean from some of the research done with stolen generation survivors around the impact of COVID on that particular group. Some really fascinating learnings to have a look at there. So we look forward to seeing you there if you can make it. Whether you're in lockdown or enjoying a little bit more freedom at the moment, look after yourself and each other, and hopefully we'll see you again soon.
Thanks, Stacey.
Thank you very much.
Thank you.
If you have any comments about the workshop or anything you'd like to see in the future, please pop it in the chat and we'll have a look. Thanks very much.